The third area of the realignment plan is the use of risk and needs assessments at the front end of the system. And I think that Dr. Latessa may talk a little bit about the value of doing this. We use what we call the Ohio Risk and Needs Assessment. It's actually a validated instrument that came out of the University of Cincinnati and also affiliated with Dr. Latessa, so we actually knew we had a good assessment tool when his name came up. And we use that all the time, but we use it post-conviction. So in other words, when they come back to us from prison or after they've been sentenced, that's when we're using it. And we use it because it identifies identifies risk and also identifies needs. So with that, we develop case plans and we kind of go from there. But there is research that suggests that it's probably a good idea for us to use that assessment as early as possible in the decision-making process. So that was one of the areas that came out of the plan from CJI, and we are actually in the process of doing that. And what I mean by that is that we would be assessing these offenders once they've been convicted but not sentenced yet, and then we would assist them. The information in there would assist the court with making more informed decisions about, is this a high-risk offender versus a low-risk offender? Is this somebody I want to send to prison? Is it somebody that I want to keep locally? And if I keep them locally, am I going to put them on probation? And what we learned from the risk and needs assessment is that we use that information to help us develop terms and conditions that are related to that person instead of using just general conditions. And I believe that that is a proven practice that works. The other thing that we're doing in the area of risk and needs assessment is we actually put a deputy probation officer at our Todd Road jail to work with the sheriff's team. And the probation officer there, once we have somebody in custody that's been sentenced, she actually goes in and does the risk and needs assessment up front. She comes up with a reentry plan and begins connecting or linking whatever services the jail has to provide with that offender, so they kind of kickstart that and get it started. And we thank Linda Oxford for her programming and her staff out at Todd Road. I can give a plug, Linda. And then what it does is it allows for sort of a seamless transition from, because that's a big issue with reentry when we talk about people who have been removed from the community for a given period of time. It's hard for them to reacclimate and reenter back into the community. So that probation officer and that team in jail is really working very closely with the field probation officer and handing off that offender for a smoother transition and not having a break-in and perhaps service. And then we also just recently, we're getting ready to start our pretrial program. And our pretrial program, really what we're doing is we are assessing non-prison eligible defendants who are in jail waiting to go through the court process. And we're using an evidence-based risk assessment for the court during the bail review proceedings. And basically what the report will do is it assesses two things: an inmate's likelihood of returning to court without failing to appear, and then also the likelihood of them committing a new crime while we're out on OR or some type of release. So we're getting ready to start that in Monday, and that will be held in Judge Coleman's courtroom. The fourth area that was identified as part of the plan is to increase alternatives to incarceration for services for offenders. We have all of our probation officers, from a public safety standpoint, all of our probation officers are armed. They are teamed with a local law enforcement officer or a deputy sheriff in all of the regional offices. And they really work very well together while they're out there doing community supervision and visits. But what our probation officers are also trained in is they're trained again in the use of a variety of assessments. Higher risk and needs assessment, as I mentioned, and also the pretrial assessment. They're also trained in targeting risk factors and to be responsive or have the responsivity in the case plans, and in terms of dosage. And I know Dr. Latessa is going to talk more about that. How much do you give and or not give to an offender to help keep them on the right track? They're also trained in motivational interviewing, cognitive behavioral interventions, and we have also developed a matrix for graduated responses and incentives. So that's a tool that we use in lieu of custody time. So not every single technical violation of probation, for example, requires an inmate or one of our clients to go to jail. We're trying to free up those beds for the people who really, really need to be there. So we come up with different alternatives, and by way of example, if somebody tests positive for drug use, then perhaps what we'll do is put them on random testing. So they never know when the number's going to come up when they come in. So that's a response that we use that doesn't necessarily require them to go to jail. And then on the incentive piece, of course, we want to reward when they're doing well. And then the other thing that we're doing as part of incarceration alternatives is we just started, as mentioned earlier, our reentry program. And the reentry program is designed to provide intensive community-based treatment for offenders who've been released from incarceration and have violated the terms of their parole. In this case, we're also including parole, post-release offenders, and mandatory supervision. Our hope is that by providing this type of case management, we'll be able to focus on promoting stabilization and accountability in the offender's life, with, of course, the ultimate goal to reduce recidivism and hopefully create long-term change. The other areas, and I want to mention these because they're really important, we have a partnership, we've contracted with our Human Services Agency for our STEPS program. That's the Specialized Training and Employment Project to Success. It's a partnership with HSA, and they have given us an employee outreach specialist and an employer outreach specialist. And basically these two people are also placed in our regional teams. They work with our multidisciplinary team. Their job is to provide employment assessments so that they can kind of see where our clients' strengths are and guide them in that area. They do workshops, they're doing job readiness, and of course job placement. One of the critical pieces with the STEPS program is one of the specialists there actually goes out and really is just hitting the pavement and talking to employers about taking the chance with some of our folks. It's been said earlier, the importance of having a job, and it's having a job, but it's also keeping the job. And so these folks from HCA are wonderful about trying to show the win-win between the employer and the offender, and we're doing well with that program. They also help us with any emergency housing because they are experts in that area. We do have quite a few people who are homeless. And then lastly, I really want to talk about our contract with strategies through Interface. They really have, I think it's such a unique situation we have here in Ventura County. We're one of the few counties in the state of California who actually allocate funding for our community-based organizations. And sadly, but that's true. And we recognize very early on, not only through this plan, but we also have always recognized the value of our community-based organizations, and we simply cannot do this job without them. And so, again, as a county, we came together and there was allocation for them. There's some things that the first thing they did is they developed this Ventura County Reentry Committee, which basically is a coalition. As mentioned earlier, there's about 40, 50 community-based organizations strong. What that says to me is these are people, these are providers out there who want to be a part of this, who have been a part of this for years, but perhaps are seeing that they need more education, more information about this thing called evidence-based practices or promising practices, and what can they do to strengthen what they're already doing so that we are helping to make change in our offenders' lives. So in closing, I believe that we've made great progress in the area of our public safety realignment plan, and we still have a long way to go. But I would leave you with that in the beginning, when realignment came upon us, and it hit us very quickly, we came together as a community. We kept working together through the efforts of the Community Corrections Partnership, and I have no doubt that we will continue to work together for a successful realignment program that we can be proud of in the